Hi everyone. So I'm going to tell you briefly about a now long-term study we've been conducting of a large cohort of adult smokers in the US who began using the JUUL vaporizer. To open with, I declare that the funding for this study was provided by JUUL Labs, but the study was conducted entirely independently of JUUL Labs by my research staff at the Centre for Substance Use Research in Glasgow. By independently, I mean that no one from JUUL Labs had any control or input to the study design, the contents of the survey instruments that we used, the recruitment, data analysis, interpretation, reporting of findings, including the decision to be here today to tell you about it. So, despite the US Food and Drug Administration not having approved any e-cigarette for use as a smoking cessation aid, e-cigarettes have become the most popular assisted method of quitting smoking in the United States, used in around 35% of smokers' most recent quit attempts. And evidence from multiple population-based repeated cross-sectional studies and longitudinal observational studies and a handful of randomized control trials has provided evidence to suggest that using e-cigarettes as part of a quit attempt can aid cessation. However, some other longitudinal research has suggested that while using e-cigarettes does increase the likelihood of a smoker attempting to quit, and in substantially reducing cigarette consumption, it's not necessarily associated with long-term abstinence outcomes. And other research has shown that use of e-cigarettes, while it does facilitate initial cessation, can also be associated with a resumption of smoking after 6 or 12 months. So the evidence so far is inconclusive, but trending towards e-cigarettes being a cessation aid. But a common feature of all of these studies has been the consideration of e-cigarettes as a largely homogeneous category, when we actually know that there's an increasing heterogeneity of e-cigarette devices, e-liquids, and use behaviours, all of which are likely to significantly affect who uses each product, for how long they use it, and what impact it's likely to have on their smoking behaviour. So obtaining data that characterise the efficacy of specific e-cigarette brands, makes, and models for aiding smoking cessation in the real world is key to understanding the individual contribution that each e-cigarette brand, make, and model can make to reducing smoking prevalence. The JUUL brand of vapor products has become the fastest selling and highest selling brand in the United States. And a pressing public health research priority now has been to characterize the impact of this rapid growth in the speed and size of JUUL sales on the population's use of other potentially more harmful tobacco products. And specifically, it's become critically important to assess the effect of using JUUL vapor products on adult smokers' use of conventional tobacco cigarettes. So I'm going to tell you about a now long-term study where we recruited a large cohort of adult established cigarette smokers who began using a JUUL. Our primary research questions, first of all, was to establish what proportion of these adult established cigarette smokers report having completely stopped smoking within the first 6 months of using a JUUL, and what factors increase and reduce their likelihood of having quit smoking at 6 months. So we recruited just over 15,000 adults at the point at which they purchased their first JUUL starter kit, either through JUUL's website or through a retail store. So we recruited just over 7,500 participants via email invitations to people who had purchased on JUUL's website, and close to 8,000 people who had purchased a starter kit in a retail store. And the way we did that was we put 500,000 business card size invitations into the packaging of the starter kit, so that when people purchase the starter kit, they open it up and they have an invitation to go online to join a study. It was an observational study of naturalistic purchasers, so people were obviously, they didn't know about this study until they had purchased their first starter kit. They completed their first online survey within the first 7 days of their first purchase, and they completed follow-up surveys at 1, 2, 3, and 6 months after their first purchase. The primary outcome of interest was whether they had smoked any cigarettes in the past 30 days at each of the follow-up assessments. And the findings I'm going to present to you here primarily are the percentage of participants who reported past 30-day abstinence from smoking at each assessment, the proportion of participants who had not quit smoking at the 3-month assessment but had quit smoking by 6 months, the percentage of people who had quit smoking at 3 months but had resumed smoking at 6 months, and also the results of some regression analyses that identify factors that were associated with higher and lower odds of being quit at 6 months. I'm going to present the results of 2 analyses. One is a sort of worst case scenario, another is a best case scenario. The intent to treat group is we include all participants who enrolled in the study and whether they dropped out at various points in the study. Where they do drop out, we converted their missing data to smoking status, the worst case assumption that those people had gone back to smoking. And we also present the results for an efficacy subset of people who responded to each assessment. So rather than provide a single estimate of a quit rate, we're providing a lower and upper bound estimate. So to the question of what proportion of adult smokers has stopped smoking in the first 6 months. So to draw your attention to, we've stratified this by where they purchased their first starter kit, retail versus e-com. But just to draw your attention to the overall figures, we estimate around 28.3% of adult smokers had completely quit smoking after 3 months, and that rose to 31.6% after 6 months. And in the efficacy sample, the quit rate rose from 47.1% at 3 months up to 54% at 6 months. So if we just assume the worst case scenario, we are estimating about 32% of adult established smokers had completely quit smoking, that had not smoked a cigarette for at least 30 days when assessed 6 months after their first purchase of a JUUL vaporizer. So to the question of what proportion of people quit and resume smoking between the 3rd and 6th month, well, we see that about 20% in the worst case scenario had quit smoking at both 3 months and 6 months, so they reported consecutive past 30-day abstinences. We estimate about 11% who were smoking at the 3rd month had completely quit smoking at the 6th month, and in the other direction we estimate around 8% of those who had quit at 3 months had resumed smoking by 6 months. So to the question of what factors are associated with higher and lower odds of reporting quitting at 6 months. So we found flavour choice to be the primary determinant of quit outcome at 6 months, and specifically by comparison to participants who reported that they were a primary user of Virginia tobacco flavoured JUUL pods. The participants who reported primarily using mint flavour and mango flavour were significantly more likely to have quit smoking at 6 months. Specifically, the primary mint users were 46% more likely, and the mango users were 40% more likely than Virginia tobacco users to be abstinent at 6 months. We also looked at the analysis by putting all tobacco flavours and all characterising flavours together, and the people who reported only using characterising flavours, which is just listed down the bottom, so they didn't use any of the JUUL's tobacco flavours, only used characterising flavours. Those people were 38% more likely to have completely quit smoking at 6 months compared to those who had only used the JUUL tobacco flavours, but not significantly more likely than people who use flavours from both categories. Frequency of use was also found to be significantly associated with quit outcome. This corroborates a number of longitudinal and cross-sectional observational studies showing more frequent use more strongly associated with quit outcomes compared to less than daily use. In our sample, we found about 60% of people who used the JUUL in all 30 of the past 30 days had quit smoking completely, significantly higher than people who used on 1 to 9, 10 to 19, and 20 to 29 days. People who purchased their first JUUL starter kit in a retail store were significantly more likely to have quit than people who first purchased the JUUL starter kit online, emphasising the importance of retail access to the product. And, sorry, I've skipped it. That was the retail store. I'll go back to this one. This is showing that people who had a higher quit motivation upon purchasing a JUUL starter kit, they purchased it with an intention to use the JUUL as an aid to cessation. Those people significantly more likely. Okay, so to summarise, this study assessed self-reported rates of past 30-day abstinence in a large cohort of US adult established smokers up to 6 months after their first purchase of a JUUL. We estimate around 28% abstinence at 3 months, around 32% abstinence at 6 months, with around 20% of smokers reporting abstinence at both time points. The quit rates were significantly higher among daily users of a JUUL, primary users of mint and mango pods, exclusive users of JUUL pods with non-tobacco flavours, those who purchased in a retail store, and those who purchased a JUUL with as an aid to cessation. I'll skip through to anyone can ask for these slides and read more about this, but I just want to touch my final point, is that in this study and in other studies we've been conducting on JUUL users, we find that in this study 67% of these first-time JUUL purchasers were aged between 21 to 35 years, so young adults, the vast majority of these new purchasers being young adults, and around 62% of the new purchasers aged 21 to 24 having quit after 6 months, and 53% of those, it should say 25 to 35, having quit after 6 months. My point here being, JUUL is obviously a product that appeals to a younger demographic. It seems hugely popular with young adult smokers. In the smoking cessation world, the age of 35 is a bit of a magic number. We're all told during training that if people can quit smoking by the age of 35, they can go on to have the life expectancy of a non-smoker. And so obviously the quitting benefits are greater the sooner people quit smoking. And here we have a product that has been largely used by young adult smokers who are 6 out of 10 roughly of whom are quitting smoking within the first 6 months of using a JUUL. These are young smokers who would be the cancer cases of the future, and this product and other products like it, it's by no means just JUUL, many other vapor products that are attractive to young adult smokers seem to be diverting these young people out of smoking at a younger age, before the harm of smoking has accumulated, before their addiction to cigarettes has peaked. And so we talk about harm reduction, but here we may be seeing a harm prevention effect, products that are helping people get out of harmful smoking before harm is caused. And I just think that's a bit of an under-discussed issue in the context of harm reduction, that it's not just for people who are currently experiencing harm and in the greatest need of help to reduce harm. Another function of these products is to prevent harm being caused in the first place. And certainly we're seeing evidence of the potential of this and other vaping products to achieve that. Thank you very much.